Arundhati has requested me to talk about the congenital malformations in the baby, the structural defects, the body defects in a newborn child. How does it happen and how it can be prevented? Now, to know that, you have to know about the period of organogenesis. The first trimester of pregnancy, especially the first 4 to 8 weeks, the different organs of the baby grows inside. And during this crucial time, any toxic influence, be it a drug, a medicine, a food, x-rays, or any other external factor which is toxic can affect the development of the baby, and the baby may be born with body defects. Now, I'll give you a very interesting example. Now, few decades earlier in Germany, lots of babies were born with seal limbs, a stunted hands and feet and hands like a seal. And so they were called seal limb deformities. Now, they were confused why this is happening. Then a German pediatrician did an extensive interview, talked with all the mothers who had this kinds of children, these kinds of babies, and she found out that all these mothers were prescribed a sedative, a tranquilizer, thalidomide, during their early pregnancy, and which led to this birth defect. So this was the first time there was a link between medicine and birth defect. And thalidomide was subsequently banned in Germany and all over the world. So now we know that any medicine, any food which may contain some infections, some parasites, which can damage the baby. There can be some genetic conditions, some gene defect in either of the parents, which can lead to a birth defect. I had a very unfortunate delivery of a girl who had 3 fingers missing from all the limbs. She had only 2 fingers in each of feet and hands. So this was a condition due to a genetic defect carried by the mother. The mother had a very subtle or very mild form of the condition in the form of some teeth deformity, but this genetic malformation, this genetic defect was pretty aggravated in the baby, which led to this condition. However, the baby is doing great in his studies in one of the prominent schools in Kolkata. This is another condition which can lead to birth defects. If the mother has very high blood sugar during the early pregnancy, then this can lead to birth defects in the form of cardiovascular, the heart, the spinal cord, and the limbs can be highly defective. So before the mother goes into pregnancy, she must have her blood sugar controlled. So how to prevent these birth defects? Number one, if a mother is pregnant in early pregnancy especially, or she is planning for a pregnancy, if she has to go to a doctor, she must tell the doctor that, "Doctor, I'm planning for pregnancy," or "I'm already pregnant." So then the doctor would be knowing which medicines to prescribe and which are the toxic medicines in pregnancy which should be avoided. Number two, her blood sugar must be thoroughly controlled. She must not take unnecessary medicines, expose herself to radiation, or take some external food which may be toxic. Then also this genetic condition. If she has some genetic or familial history of birth defects, she must go to a geneticist, a pediatrician, so that they can discuss what is her chance to get a defective baby. And this genetic counseling and genetic studies can prevent that kind of babies again born into the family. So during this early pregnancy, especially from the planning period, if we take certain measures, these birth defects can be avoided. Other thing is that once any serious birth defect is detected in the ultrasound scan, we can always terminate that a pregnancy. So a good anomaly scan, fetal abnormality scan, must be done around 20 weeks of pregnancy. Please subscribe to my channel to know these topics so that I can dish out more and more of these videos for general awareness.